I saw one comment and she was telling to describe leukemia in simple English language. So to understand what is leukemia, you have to understand how blood cells are formed inside the bone marrow. So let's say this is the bone and inside this is marrow. So initially a stem cell is formed and that one cell differentiates into myeloid progenitor and lymphoid progenitor cells. And this myeloid cell differentiates into megakaryoblast, erythroblast and myeloblast. And this lymphoid cells again differentiate into lymphoblasts. And this megakaryoblast forms platelets. This erythroblast forms RBC, and this myeloblasts forms neutrophils, monocytes, then eosinophils, basophils. So there is multiple steps in the differentiation of myeloblast. This myeloblast forms promyelocyte, then it forms myelocyte. Then myelocytes differentiates into metamyelocytes, and this differentiates into neutrophils, basophils, eosinophils, monocytes. And this lymphoblast forms natural killer cell and lymphocytes. And you know there are two types of lymphocytes, B lymphocytes and T lymphocytes. So these are mature cells, these platelet, RBC, neutrophils, basophils, eosinophils, monocells, natural killer cells, B cells, T cells. These are mature ones. These are baby cells. Okay. So when the cell differentiation is arrested, then leukemia results. So let's suppose the differentiation of this line is arrested at this stage. So what happens? These myeloblasts accumulates and these neutrophils, basophils, eosinophils, monocytes cannot form. So there will be deficiency of these mature cells inside the bloodstream, and these are infection fighting cells. These are policemen of your body. So when there is any bacteria or any fungus or any parasites, these cells stands to kick them out. But if there are deficiency, then you will suffer from variety of infections, and so your body will sense that, oh, there is deficiency of these policeman cells in the body, so I need to produce more. So this gives feedback to stem cells, produce more. So it will again produce more, and from here the differentiation does not occur. This arrest in the differentiation can be multiple factors, either due to translocations or chromosomal abnormality. Okay, that can be either familiar or variety of toxins from the environment that arrest the maturations. So only myeloblast accumulates in the bone marrow, and that spills in the peripheral smear. If there is many myeloblasts in the bone marrow, that starts spilling in the peripheral smear, and you can find this in peripheral smear with PS4 cytology report. So there are myeloblasts. So functional cells, there is deficiency of functional cells, and there is just accumulation of these immature cells. So what happens that if there are multiple myeloblasts, they starts to compress these cells as well, megakaryoblast, erythroblast, because there are variety of blast cells. So they hamper the differentiation of these platelets, RBC, these even lymphocytes, these hamper the differentiation. So what happens that you will have deficiency of even platelet, deficiency of RBC, and you know that RBC carry oxygen to the all cells of the body. And if there is deficiency of RBC, what happens? The cell gets deprived of oxygen, and this platelet helps to make clot. When there is any bleeding, it forms platelet plugs and it seals the blood vessels. But if there is deficiency, then patient have tendency to bleed, and obviously the patient cannot fight with infections, will be susceptible to infections due to deficiency of these policeman cells of the body. So basically leukemia is arrest in the differentiation of these blood cells, these stem cells. So this can be acute leukemia or chronic leukemia. Acute means patient have high number of blasts, these myeloblasts or lymphoblasts greater than 20%. It means, what does it means? It means that it is producing this blast rapidly. So if there is rapid production of these blasts, the patient will have acute presentation, but it is producing slowly, it is a smoldering type, then patient won't have much symptoms. Patient may present late, patient won't have just fatigue and he will ignore. So patient may have chronic leukemia, that is called chronic, but patient have acute presentations, like patient has unremitting fever, patient has bleeding tendency from either mouth or from GI tract or whatever, or patient has recurrent infection. So due to this accelerated production of these blasts, what happened, patient may have acute presentation. That's why we call acute leukemia, and if patient present chronically, then we call it chronic leukemia. So what we have to do, we have to in treatment, what we do, there is a problem in the differentiation of these cells, either myeloblast or lymphoblast, or the differentiation problem may be here or here. Ultimately, the mature cells are not being circulated in the peripheral smear. So anywhere can be differentiation. So what we can do, we can open the this arrest of the differentiation. So there are variety of drugs like all trans-retinoic acid that helps facilitates differentiation. So this myeloblast again starts to progress towards the maturity, and they will form mature cells, mature neutrophils, mature monocytes, mature basophils. So what we can do, we can open the gate of arrest, so that cells can differentiate into mature cells. Other thing is that what we can do is that when there is high amount of these blasts in the bone marrow, this bone marrow is the house of only blasts. So what we can do, we can give cytotoxic drugs, like in AML we give cytarabine, anthracyclines. Those are cytotoxic drugs. They kill all cells of the body. Those are rapidly dividing. Since it is rapidly dividing, so obviously it will target this, but it will not only limit this, it will also target rapidly dividing cells like hair follicle cells, in the cells of the GI tract, epithelial cells. No, so it is not only specific to this, but it will target multiple sites of the body where there is rapidly proliferating cells. So that's why there is many side effects of these cytotoxic drugs, because these drugs do not is specific to these hematopoietic stem cells. So obviously this will destroy this. So all blasts will be destroyed, and even these cells will be destroyed. So this bone marrow will be now empty of the cells. Now these stem cells again starts to differentiates further, because there is everything is deleted now, everything is deleted, and again the story of differentiation begins now. So again this differentiates into lymphoid, this myeloid series, lymphoid series, and again the differentiation occurs. So again there is chance that again the same problem can occur, again the differentiation arrest can occur. Okay, that's why after induction therapy we give consolidation therapy, and again we give maintenance therapy, because if again there is chance that their arrest of the differentiation can occur, then we have to kill those cells. So we give induction so that all cells are killed, and now again it has formed. Again we give consolidation therapy to again kill, again maintenance therapy to again kill. So in between we let the cells grow. Okay, and if there is once you have killed those cells, then there is a chance that again the differentiation arrest will not occur. But you cannot say again differentiation arrest can occur once patient has started producing these normal cells, and after 6 months or after 1 year patient will again have presentation, that is called relapse. So once there is either chromosomal abnormalities or any due to any defect, then there is again chance of relapse. That's why we have to follow up the patients even though once it has been treated. And if patient is at high risk, in high risk cases, what we do, we don't give these cytotoxic drugs, we directly go for bone marrow transplantation. In bone marrow transplantation, what we do, that we ablate all these cells from the bone marrow, and if it is ablated, and we transplant new cells. So when there is transplantation of new cells, that is called allogenic transplantation, then there is chance that there is not such defect in the those cells, and these cells can differentiate normally and make new cells. But we cannot say there can be again failure of bone marrow transplantation as well. But there is also chance of failure of bone marrow transplantation, and there are variety of other modalities like CAR T cell therapy, and nowadays these chemotherapy drugs are being developed as targeted drugs. They target to these abnormal cells, so that they won't harm the normal cells of the body like GI tract, epithelial cells, or hair follicular cells, or other rapidly dividing cells of the body.